Good morning, everyone. I think you're going to hear a series of consistent themes throughout this meeting, but as Anna's outlined, I will be bold enough to say that I think that biomarkers and molecular diagnostics represent the intellectual foundation of probably one of the most important value drivers in contemporary medicine if we are to make improved diagnosis and rational treatment selection, the so-called precision or personalized medicine, a reality. So why do we have a problem in biomarker identification, validation, and qualification? And apologies for the alliteration, but I'm going to try and capture it in a series of S's. It starts with sloppy science. We have a publish and vanish problem. Anne already referred to it. Huge numbers of papers are published, which never then can either be replicated, and as you know, there's a growing problem with regard to the reproducibility and replication of many academic studies. But sloppy science isn't just about the question of whether or not the data can be replicated. It's a series of S's. Specimens. Dr. Compton will address this in much more detail, but if you start with poorly characterized samples of dubious validity and provenance, then in fact, whatever you generate will be of dubious relevance. Statistics and scale matter. It's the small n problem. Far too many papers are published which do not have adequate statistical power to actually have meaningful relevance, whether it be at the discovery level or in clinical development. And then the big S, which Anne has already referred to, standards, standards, standards. That is the core theme in everything, whether it be the technical assays, consistency in data formats and ontologies. The types of databases we have are largely incompatible and lack profound interoperability. Study design, and as Anne said, we have semantic anarchy in terms of trying to relate terminology used across the group, and the next S of sequencing will just add to that unless we actually have some very rigorous standards set for the rapid proliferation of genome sequencing. But the issues are not simply technological. They're as profoundly influenced by organizational and logistical issues. I characterize it again with apologies for the alliteration. Silos subvert solutions, and we live primarily in the life sciences in a siloed world. People operate in single disciplines, don't operate across multidisciplinary frameworks, and it's reinforced by the reward structure in academia, which rewards single discipline science, and it's reinforced by the grant funding mechanism with the current dominance of R01 grants as opposed to support of large team-based science. The next S is sharing, or more importantly, the lack of. The failure of funding agencies to reinforce provisions for full data disclosure and deposition to public databases. That is a requirement for receiving public funding, but neither the journals or the funding agencies are adequate in their ensuring compliance that actually happens. So as Anne has emphasized, the next S is systems. Systems-based end-to-end approaches are the only way that we will actually begin to deal with the problems that you will hear throughout the day. We make no apologies for the fact that this is a very complex logistical exercise that involves an extraordinary repertoire of diverse skill sets and constituencies. Science, medicine, the regulators, the research funders, payors, patient advocacy groups, new linkages between academia and industry. We recognize that these are far from straightforward logistically or culturally, but we cannot continue to waste the vast resources which have been invested in this arena with the current flawed and fragmented approaches. We need another S, stimulus. A stimulus not only for change, but a stimulus for incentives for industry to invest in this arena, because the reimbursement framework for biomarkers is far from clear in terms of the stimulus for industry. And then the last S, by definition, must be solutions. It is the raison d'etre for the MBDA, but it is predicated entirely on the principle of convergence between disciplines and between sectors, and it requires us to design and manage complex integrated knowledge networks across engaged and relevant stakeholders. We will spend much more time on this morning and this afternoon, and we hope many of you will come this afternoon. But again, our aim is solutions and radical change. Anne, thank you.